Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Gastrinoma. So in gastrinoma, first is that is also the aka the Zollinger-Ellison syndrome. So this is the most common function and the malignant neuroendocrine tumors of the pancreas. So it is MC, the most common functional, and also the malignant. So most common functional and the malignant neuroendocrine. So neuroendocrine tumors, and this is nothing but the pancreas. So the most common site includes the duodenum, and it is greater than that of the pancreas. So duodenum greater than pancreas. It is 75% sporadic and 25% is associated with the MEN1. So in terms of the MEN1, so in MEN1, the boundaries, the MEN1, the common site is the duodenum. So in MEN1, the common site being the duodenum, and 90% is located in the triangle of the Pesaro. So what is the triangle of the Pesaro? There is the boundaries. So let's look at the boundaries. There is a junction. There is junction of the cystic duct. The junction of the cystic duct as well as the CBD. So junction of the cystic duct as well as the CBD. Next is the junction of the second and the third part of the duodenum. So the boundaries, it includes the junction of the cystic duct as well as the common bile duct. Then comes the junction of the second as well as the third part of the duodenum. So it includes the second as well as the third part of the duodenum. Then what is the other thing it includes? So the other thing it includes is the neck of and the body of the pancreas. So neck and the body of the pancreas. Now the increased gastrin production, it leads to the increased acid production. So gastrin increases the acid and it causes the peptic ulcer. So it causes peptic ulcer disease. Now what are the clinical features? The clinical features is that it includes the most common being the abdominal pain. So abdominal pain and other symptoms like the retrosternal heartburn, as well as dysuria, diarrhea, and large multiple jejunal as well as the refractory ulcers. Now what is the diagnosis? Diagnosis is there is a diagnostic criteria, there is a gastrin, it being over 1000 pg per ml, and then comes the basal acid output. Basal acid output being greater than the 15 MEQ per hour. Now what is the best provocative test? The best provocative test is nothing but the secretin, a stimulation test. So this releases the gastrin. So releases gastrin, it is greater than the 200 pg per ml. Now localization, there is a somatostatin, a receptor scintigraphy. So it is known as SRS. So treatment wise, there is a drug of choice, there is a PPI proton pump inhibitors. Treatment of choice, there is a pylorus preserving or Whipple's procedure. Whipple procedure. To learn and grow daily like this, please do subscribe.